Hi, we're here with Associate Professor Laura Shannonhouse at the National Suicide Prevention Conference in Adelaide. Laura, you gave the International Keynote speech yesterday morning. Can you tell us a little bit about what that was about and how it went?
Sure. It's really an honor to be here and to be invited and to get to learn from this community. Yesterday, I talked a little bit about a clinical trial that we've been working, my team and I have been working on for the past 3 years. It's called the Be With Project, which stands for Belongingness and Empathy with Intentional Targeted Helping. And it's a partially nested randomized controlled trial testing whether a small dose of sincere connection makes a difference for older adults at a time they might need it the most.
Tell us a little bit about that word dose. I was
Yeah.
interested that you use that word, and obviously that's
Yeah.
an intervention in research word.
Yeah.
It's an interesting one to use in this context, isn't it?
Sure, yeah. It's kind of a little bit of jargon, treatment jargon, but it's an 8-week warm calling program. So we really taught people how to develop reciprocally caring relationships with older adults, and we gave them particular training. So about half the older adults in our clinical trial received treatment from 30 people that we trained in a 2-hour kind of relationship training that's grounded in the befriending literature, in older adults, and also narrative reminiscence. And then the other 30 helpers that we trained provided treatment to several hundred more older adults, and they had the relationship training plus an aging variant of LivingWorks ASIST. And so they were able to be able to do life-assisting interventions when one might have been needed the most.
And what sort of difference did you see between the people who were able to sort of connect and have that warm conversation and those who could do that as well as have the assist suicide intervention skills?
Yeah, we actually see there's about 777 older adults across the whole trial, and a group of those also received no treatment. So when we compare the two treatment groups, both of them have improvement, whereas compared to the control group, but across pretty much all the variables: depression, social needs being met, loneliness and isolation, these variables, even thwarted belongingness, which is one of those states, one of the key predictors of suicide desire. We see that the group that was trained in LivingWorks ASIST, the older adults receiving that 8-week treatment from that group, produced, manifested more mental health, positive mental health outcomes than either the control group or the other group.
And you clearly have a passion for older adults
Yeah.
and supporting them. Where does that come from?
Oh my gosh, I think my grandmother can get emotional about it. She really taught me so much, and every time I tried to call her on the phone, especially during the pandemic or before the pandemic, she would always figure out a way to make it about me and turn the conversation around. And so for just decades, she's impacted my faith, impacted my character, impacted how I see the world. And she lived a very full and wonderful life. And I feel like in some ways she's still around me and looking out for us. And so I really felt privileged and honored to get to be her granddaughter.
It seems, I'm sure the research you're doing now and the support, hopefully that will lead to is a wonderful legacy for that. You have some aims and some goals in mind about where this can all lead. Where does it head?
Sure. When the National Council on Aging in the United States doesn't have any suicide intervention training on its registry of evidence-based programs. And so even though ASIST is evidence-based, even though SAMHSA, a sister administration, has recognized it being evidence-based, the older adult community, the Administration for Community Living, needs to see this kind of evidence with older adult populations in order to get the programs like ASIST, like LivingWorks ASIST on the registry. And so this trial, we're hoping to really garner the evidence to make that happen. And if that happens, then that will unlock Title III dollars across the entire United States, so that states and AAAs, area agencies on aging within those states, and the counties underneath those AAAs, and even the senior centers underneath those counties can use those dollars in order to promote life with older adults.
Laura, it's been fantastic having you here in Australia as an international guest at this conference. Hope you have enjoyed your stay and collaborating with researchers, and we look forward to following your work from here.
Oh, thank you so much for having me. It's been a delightful experience.